I'm a first-year medical resident. Today, I wanted to talk about what it's like having friends and family asking me for medical advice. I've only been a doctor, well, you can count it in days or weeks, but not very long. And I've already had people say, what's this? Should I get it checked out? And actually, just recently, my cousin texted me asking, what does it mean to have black vomit? Graduating from med school is sort of like learning how to walk. You know, we see a little kid who's maybe 1 year old and you say, wow, they can walk, that's so amazing. But really, we're all sort of hovering around them and people cover up corners of things that are sharp so they don't whack themselves in the head. That's sort of what we're like right now. Like, I've got this massive institution that's looking out for me, huge teams supporting me, and people are watching to make sure I don't mess up, that I'm learning in a safe environment. So when I have, friends or family or someone come up to me outside of that little bubble that I'm in and ask me, what do you think about this? You're a doctor. All of a sudden, it's kind of like asking that little baby just to start like sprinting. So some things are super easy to pass off. Like if someone actually had a newborn and had a question, that's so far out of my field of what I'm learning and studying. It's easy for me to say, I'm not even going to touch that. I don't want to give bad advice. But it gets tricky when it's something that I'm actually studying. That's what happened with my cousin. So when she texted me, I was just in a restaurant and I get this text about the black vomit. And it's sort of uncanny because right now I'm on the gastroenterology service. So those are the doctors who take care of everything that's, in the mouth and then all the way out to the other end. So the stomach, the intestines, all of that. And probably once a day we get a consult where we have to go and see a patient because they have black vomit. And lots of things can cause that. It may be nothing, could be just they had Pepto-Bismol or ate some things, some like particular food. But the thing that we get worried about and why they call us is just in case that person's bleeding. So, of course, that's the first thing I think about when I get this message from my cousin. I call her up immediately, and as the phone is ringing, it's like my brain is sort of split in two. On one hand, over here, I'm this worried cousin. I have all these emotions and I hope she's okay. And I've got all of that going. And on the other side, kind of feel this doctor side kicking in, thinking, okay, so what are the issues? What questions do I have to ask? Is she safe? What's the next step? So it's very analytical. And they're kind of both here. But as soon as she picks up, it's like all doctor brain takes over. But it got me thinking, when it comes to family and friends then, where's the line? I think the take home point for me anyway is to start thinking, what was it like before med school? I was a caring friend and a loving